Is your dog or cat constantly scratching? In the next 60 seconds, I will show you 3 things that can bring real relief today and also explain when you need to take your pet to the vet right away. Stay until the end because I prepared a free checklist that can make your vet visit much more effective. In this video, I am going to explain in a clear and simple way why skin allergies happen in dogs and cats and what you can do right now to break the cycle of itching. Infection and suffering. Here is what most pet owners do not realize. When the skin barrier is damaged, one small itch turns into a repeating cycle. The pet starts itching, then scratching, the skin gets wounded, an infection appears, and the itching becomes even worse. Sometimes all it takes is a single flea or one ingredient in the food to start this entire process. There are 3 main causes you need to know. The first cause is flea allergy. This is an allergic reaction to flea saliva, and even one flea can trigger intense itching in sensitive pets. The second cause is atopic dermatitis. This is a genetic sensitivity to things like pollen, dust mites, or mold in the environment. The third cause is food allergy. This happens when the immune system reacts to a specific protein in the diet. In many cases, pets also develop secondary bacterial or fungal infections, which makes the itching much worse. If you are watching this right now, there are 3 things you should do today. The first action is to observe and document. Use your phone to take photos of the affected areas, such as the paws, ears, and the base of the tail. Write down when the itching gets worse, for example at night or after meals. This simple step helps your veterinarian reach the correct diagnosis much faster. The second action is to check for flea dirt. Use a flea comb over a white paper towel and add a drop of water. If the spot turns reddish, that is flea dirt. Even if you do not see live fleas, an allergic pet can still react very strongly. The third action is to book a veterinary appointment and treat this as a priority. Tell the clinic that your pet has severe itching. If you notice open sores, a strong smell, or your pet reacts aggressively to touch, ask for urgent care. Here is what usually happens during the veterinary visit. The veterinarian will examine the skin and may perform cytology tests and skin scrapings. If an environmental allergy is suspected, blood tests or intradermal testing may be recommended. For food allergies, the most reliable method is a strict elimination diet. This process takes time and usually lasts between 6 and 10 weeks. To control the itching, veterinarians commonly use 3 types of treatment. Apoquel is an oral medication that often starts working within a few days. Cytopoint is an injectable treatment that can bring relief within 8 to 12 hours and can last for several weeks. Corticosteroids also reduce itching quickly, but they are not a long-term solution. If there is a secondary infection, antibiotics or antifungal medications must be used first. Now, please pay close attention to this part. Seek veterinary care immediately if you notice pus, a strong or unpleasant odor, weight loss, loss of appetite, or clear signs of pain. These signs indicate that your pet may be suffering more than you realize. Now imagine this situation. 2 weeks from now, your pet is sleeping peacefully, the fur looks healthier, and the constant paw licking has stopped. This outcome is possible with the right diagnosis and consistent care. If this video helped you, subscribe to the channel, turn on notifications, and share this with another pet owner. In the comments, tell me where your pet itches the most, such as the paws, ears, or tail. I will reply with the best next step for your situation. Take care. Your pet depends on you. The right information can truly save lives.